Madam President, the numbers are in. Over 7 million Americans have enrolled through the health exchanges around the nation. When we passed the Affordable Care Act 4 years ago, the projections were that we would hit the 7 million mark of enrollees at the close of the first year of enrollment. We have exceeded those numbers. We've exceeded those numbers even though we had a very rough rollout of the exchanges, and people were frustrated when they couldn't get the information as quickly as they wanted. But Americans wanted insurance, and they knew that they could get affordable coverage, and they stuck with it. And now we know that, in fact, over 7 million have enrolled. And when we finally see the numbers, those numbers are going to go up because there's a lot of people who are in line. On March 31st, the processing has not been completed. We're going to see more. Plus, we have the Medicaid expansion, which is going to bring millions more under health insurance coverage than we had before. But over the last 4 years, we have seen incredible progress and help to all Americans with their health coverage and their health costs. No longer do we have pre-existing conditions. A family that has a child with asthma does not have to worry about whether that asthma will be a pre-existing condition to full coverage. A woman does not have to worry about having a child being a pre-existing condition to full coverage. Parents can keep their adult children on their insurance policies to age 26. There's no longer any caps on your insurance. Many Americans thought they had insurance coverage, only to go through a serious illness and find that their insurance had a cap that did not cover all the expenses. No longer do families have to worry about being forced into bankruptcy because of an illness or an injury. Our seniors now have much stronger coverage under Medicare, with preventive care covered without any deductibles. Prescription drug coverage is now more complete, with that so-called donut hole, that coverage gap, being filled. And the solvency of the Medicare Trust Fund has been extended by a decade. Small business owners have choice of type of plans that they want. They don't have to worry about one person in their employment getting sick during the year, causing an astronomical increase in their premiums. And they also have help and affordability in paying for their health insurance for their employees. Community health centers have been expanded and covers such coverage as prenatal care. In my own state of Maryland, we're seeing that the low birth weight baby numbers are declining. Infant mortality rates are going down. We are now providing more pediatric dental services within the community. That's all as a result of the Affordable Care Act. We've now passed the March 31st date in the first year of enrollment. And now many Americans have affordable, quality health care and have a choice. They have a good product at a reasonable cost. Now, everybody hears the numbers, and I'm just going to go through a few. I have literally hundreds of letters that I've received from real people whose real lives have been affected. They're one of those 7.1 million people, and we could read millions of accounts. Dr. Michael L. of Cecil County, in a letter to the Baltimore Sun, said, "My wife and I would like to thank President Barack Obama for helping us save almost $4,000 a year on health care. I am 61 years old with pre-existing conditions of asthma, which is under control with medication. Yet before the Affordable Care Act, my insurance company felt it necessary to charge me 25% more for my insurance coverage. I'm sure there are many others like myself with pre-existing conditions who will see a savings on their coverage. The public should know that since Fox News and GOP would have us believe Obamacare helps no one and will cost everyone more." Colleen of Anne Arundel County posted on her Facebook, "Senator, I'm 26 years old, and I've been on Cobra paying $570 a month for coverage because of pre-existing condition, asthma. I want to thank you for fighting for the Affordable Care Act. I applied recently and was accepted into the program. I now pay $243 a month with a $500 deductible. Thank you, thank you, thank you. The Affordable Care Act is a human right. Thank you for fighting on my behalf." Kelly M. wrote, "I have a new plan. I haven't had insurance for years. When I applied for insurance before, I was denied for pre-existing conditions, even for plans with huge deductibles. I signed up on the Maryland Health Care Exchange back in October, and by January 1st, I was holding an insurance card from CareFirst Blue Shield, and I've already had my first doctor appointment. It works. I am proof. I am so grateful that I can take care of myself with dignity without having to go to the ER whenever I'm sick or have to spend half my paycheck at an urgent care center. I can do all the preventive measures that I've been putting off and get back on the road to health. It's a good feeling. Paul from Frederick County, Maryland wrote, "My daughter and I met with a navigator from the door-to-door health care to discuss applying for health care. We have been having problems with the enrollment process. I have been paying for a separate plan for her, and now she is paying $55 less per month. Now my daughter gets to have a comprehensive plan, cheaper than before, without any interruption on her coverage. Thank you." Ryan from Prince George's County wrote, who has aged out of her parents' insurance. Ryan was suffering from asthma and a sinus infection, but she was unable to afford a doctor's visit on her own. After attending a local Affordable Care Act information session, she logged on to Maryland Health Benefits Exchange and was able to go through the entire process and picked an affordable health plan. She is now insured and able to get the treatment she needs. Ryan is 26-year-old. You know, under 26, you can be on your parents' policy. We talk about those young people who think they'll never need insurance. I was in downtown Baltimore over the weekend at a fair where we were enrolling people in the Affordable Care Act. I saw many, many people of Ryan's age, young people who over 26 of age, who are there to find out whether this was right for them. When they left, they held an insurance card. They had enrolled because they found out how reasonable the price was for a young person to get comprehensive coverage. Now, I can read through a lot more letters. I have quite a few more, but I know some of my colleagues are waiting to speak on the floor. And maybe at a later date, I'll come back and read some of the other letters that I've received. But the point I want to bring up is that we have fundamentally changed the healthcare system from a system that was basically a sick system, only if you got sick, you figured out how to pay your bills, maybe you went through bankruptcy, to a healthcare system where we keep people healthy, where we provide comprehensive preventive health care so people can stay out of emergency rooms and can stay out of hospitals. Yes, we have benefited those who had no health insurance. Millions of people now have coverage who didn't have coverage before the Affordable Care Act. We have brought them into the system. They don't have to fear bankruptcy. They can take care of themselves, and they can do it in a more cost-effective way for all of us. We've helped our seniors, no question about it. They now have more comprehensive benefits, and they have a system that's on a more stable financial footing. But we also have helped those who already had insurance. We've helped them by giving them a better product, by making sure that their insurance company, the premiums they charge, are used for your benefits and not excessive profits. Must spend 80 to 85% of the premium dollar on benefits. Otherwise, you get a rebate. And we've gotten people out of the emergency room. I was asked on C-SPAN today, well, aren't we helping the providers? After all, people go to hospitals now are more likely to pay their bills. Absolutely right. But guess who paid for that uncompensated care? Those of us who had insurance. Our premiums are higher as a result of people not paying their bills. Well, now they're going to be paying their bills. First of all, they're going to stay out of the hospital, which will save us all money. But if they need to be in a hospital, they'll have the insurance coverage to pay for it. The Affordable Care Act has worked for all of us by bringing down the growth rate of health care costs, by making the system more efficient. And today, I think we can acknowledge that the fundamentals are sound. People are taking advantage of it. And we hope that as we go forward, more and more will. I'll just make one final point. When Medicare Part D was passed and we had projected the number of seniors who would take advantage of it, we hit about 70% of our projection in the first year. On the Affordable Care Act, on the health exchanges, we're over 100%. This program is working. People know it. The more they know about it, the more they like what they see.